Okay, so the program has been developed last year. It was an initiative of the Australian Medical Association Queensland in response to a report that came out from Beyond Blue in 2013, which showed incredibly high numbers of psychological distress in medical students and doctors. And we wanted to target that and help these doctors to help themselves before they can actually help others. So the basis of this program is mindfulness. We have done a systematic review beforehand to actually identify the key components that a program like this should have. And it turned out that mindfulness is incredibly important, also for doctors, to have that ability to just have this little bit of distance between their emotions and thoughts and the communication they have with the patient. And so it's based on mindfulness, but it also has very practical applications. We do role-play scenarios, difficulties on the job, how to handle yourself when you're in communication with difficult people, where to get help. It's incredibly important to know where to get help.
Now this will be the third time that I've done this course this year. We did one at the start of the year and we did one a couple of weeks ago and we're finishing off with one today. I think it's been a fantastic reminder to focus on the things that don't matter and the things that do matter when you're working as an intern at Rockhampton and Gladstone hospitals. You're often faced with a lot of challenging situations. I think it's important to let go of some of the things that may stress you or upset you so you can focus on giving appropriate patient care. Well, you always have to deal with a busy workload, requirements from many different staff members and procedures to follow, and it's always challenging when people that you care about, the patients that you're looking after, pass away or get very sick, so that can be some of the stresses. I think the most challenging thing that I faced this year is dealing with the death of one of the patients that we are looking after. I had to inspect the patient, sign the paperwork, do the death certificate, and having dealt with that patient, it was challenging, but because I knew that she was well looked after and was happy to go in peace, it was actually quite a therapeutic experience for me in the end and her family. The key to what this program is teaching us, it's very important that you look after yourself. If you can't look after yourself, then you can't look after others, and that's our primary responsibility as doctors, so it's absolutely important we look after ourselves. For me, it was simple reminders like better foods to be eaten, more sleep to be had, and more exercise to be taken. I think that makes you a more robust person.